Welcome to the Immune Edit. I'm Dr. Doug Jones. If your immune system feels like the enemy or you're just tired of not feeling like yourself, this space is for you. Welcome back. Nice to have you. Thanks for tuning in. It's another episode of Immune Edit. And today is going to be an interesting topic because I've been thinking quite a bit over the last several weeks with all of the things that's happening in the world with the CDC, with our HHS director, with President Trump, with certain recommendations that are coming down, and also coupling that with just the challenges that I deal with as a practicing doctor every single day. There are so many barriers currently to us delivering healthcare. And I want to confront this head on today. And I think if you stick with me till the end, you may see maybe a different perspective of some of the challenges, some of the real life challenges that we face. In my world, I'm a practicing board certified allergist immunologist. I have a busy clinic. It's primarily outpatient based. Part of my job is to keep people out of the hospital quite a bit, so I don't do a lot of hospital consultations. So it's primarily outpatient based, but that's just kind of where I'm at. But I think about the challenges that I face every day with patients and the barriers that are there. It's actually not even medicine. Like it's not, even though I deal with really complex patients, patients that have complex neuroimmune problems, that's still not the biggest barrier. And when I thought about it, it's like there's three things: insurance. And granted, I'm practicing in the United States, and I know there's many people outside the United States that listen. But in the United States, with our current insurance platform, that is the number one barrier and challenge to delivering healthcare. Number two, currently, is our government with the president and RFK Jr. as head of HHS. And number three challenge is combating the misinformation from influencers. It is relentless. And these three, actually, two of the three are tied together. So two of these three deal with misinformation and pseudoscience. Primarily influencers and our government currently deal with a lot of misinformation and pseudoscience. All three of these currently present barriers to doctors giving great care to patients. One of them deals with the selling of unnecessary tests, procedures, and supplements, which is influencers. That's the three major barriers. Let me dive into this a little deeper. And this episode, candidly, may piss a few people off, but I don't really care. This is what I deal with, and I'm here to talk straight. I'm here to try and present my views. And if you like them, great. If you don't, you have a really empowering way of just turning it off. But we have a medical system in the United States that emphasizes speed, volume, and intervention over thought, quality time, and prevention because it caters to insurance and not to the patient and doctor. Why? It's a system that also doesn't hold a patient accountable. And patients often come looking for someone else to give the answers, but it needs to be a team effort. When we talk about shared decision making, it's not just a shared decision making in terms of the doctor-patient relationship, but I think it also needs to be a shared implementation of that decision where both are accountable. And I can't count how many times we have given certain plans, but there's non-compliance with those things. I think both the doctor and the patient have to be very active participants in their healing. Uh, Take, for instance, patients can rate their doctors, but doctors can't rate their patients. And I often wonder if this was like an Uber system where you could rate each other, things might change a little bit. Because sometimes when those ratings come out, you're getting just one side of the story, but doctors literally can't even acknowledge it. We can't, because of HIPAA and confidentiality, we can't confirm nor deny whether we even have a relationship with that patient. So it makes it very difficult. Doctors are also faced with enormous insurance and government regulation burdens that raise our overhead significantly. We spend a tremendous amount of uncompensated time just trying to get patients to have access to care. It's insane the amount of time that we have to spend that's uncompensated in just trying to implement our plans or get patients access to the treatments that we're trying to deliver for them. It is a system currently where, we need to justify every single lab test, every single medication, every single procedure, every single thing we do. Doctors are needing to prove to the insurance company the medical necessity of that, even very simple things. And it takes time, it bogs the system down, and it further perpetuates this issue where docs have to have more volume, see more, do more with less. But I think it's kind of at a breaking point because there are many, many, many doctors across the United States currently that can't cover their overhead. Despite their best efforts, despite efficiency, despite all the things, they can't even cover their overhead because of these regulation burdens, because of prior authorization minutia games that the insurance companies played. I don't call it a prior authorization approval anymore. I call it the prior authorization auto denial process. And how do we get to appeals, and how do we constantly deal with the moving goalposts that insurance company poses? They have an automatic conflict of interest in terms of patient care. And weirdly, they still don't focus on prevention, which would ultimately save everyone time and money in the long run, is if they focused on, had some more effort in prevention instead of all of the intervention. And now we face more pressure than ever because we have to spend time combating the pseudoscience that's put forward by our government, even our head of HHS, RFK Jr., and influencers. So even though we have a small amount of time with patients as dictated by insurance, a good portion of that time now is spent dispelling myth, combating the pseudoscience. And what's really telling in terms of how far we've come is, we have a president who has proven doesn't really follow anyone. He follows his own command and his own thing. But weirdly, with his not latest, but his recent conference about Tylenol and autism, for the first time that I have seen with this president, he bowed down to somebody else. He literally bowed down to RFK Jr. And he has become RFK's little minion, as opposed to other people being President Trump's minion. And it's fascinating to me that I'm not really quite sure how that dynamic and that relationship has evolved such that President Trump just bowed down to him. And it's obvious that he did, because he put forward all of this misinformation about the detriments, reported detriments of acetaminophen leading to autism. where there is no proven cause and effect. He couldn't even pronounce the word. He struggled just pronouncing the word. It tells us he knew nothing about what he was talking about. So the president of the United States gets in front of the world and can't pronounce a word, yet he's trying to profess that he is some authority figure on this. And that he then further goes into breaking up the MMR vaccines because he feels it's the right thing to do. Well, gosh, I feel really good about a lot of things, but it doesn't make it right. All of this is coming from the misinformation, the misunderstanding of science that Robert F. Kennedy Jr. continues to perpetuate and has done for over 20 years. And it's fascinating to me that that is the one person that Trump caters to. And I don't understand the dynamic with that. I would really like to understand it, but it's just fascinating. And now we're faced with real health problems. We're faced with a measles outbreak across the country that we haven't seen in decades. We're faced with our public health being at risk, jeopardized by this. And it begs the question to me, because science is science. There's something called a scientific method. That scientific method is such that you come up with a hypothesis, you then design a study to prove or disprove the hypothesis. You then take those results, you interpret those results, and you apply it. That is the scientific method. Somehow that's been abandoned. And it's more important for maybe poor studies to be viewed as, the truth. You have now RFK Jr., who has said we shouldn't trust experts, that everyone should do their own research. Well, the problem with that, and I don't have a problem with people doing research. I don't have a problem with people trying to do their best. But the fact is, you can't understand the immune system by doing a weekend search. You just can't. It takes years and years. There's so much nuance and complexity to this that it's impossible for everyone to do their own research. There's a reason why everyone on the planet shouldn't perhaps be investing all of their money into the stock market. You have to understand that. You have to understand the nuances of the stock market. And most people may actually pay other people to invest for them. Why? Because they know the nuance. Some people can do that research. They can get to that level of understanding, but it's crazy how much science is now disregarded. And I think why? Why is there such an acceptance of pseudoscience? Verifiably proven pseudoscience. Why is it becoming so prevalent, and why has our standard lowered so much? Let's start with the pressures that doctors are under because of insurance and government interference. Doctors don't have time to address complex care and the thought that is needed for patients right now. Doesn't mean we weren't well trained, doesn't mean that we're unintelligent. Simply, doctors don't have time to address it because of the system we're in. And a lot of times, influencers, for instance, will create distrust and say, well, your doctor doesn't hear you, your doctor doesn't listen, your doctor doesn't order these tests, or your doctor doesn't do this, or your doctor doesn't do that. There may be truth to that. I don't think by and large it's because doctors are bad people or uneducated people. They're in a system that promotes volume and intervention, not quality time and prevention. They only have so much time. And a lot of that time now is eaten up by dealing with insurance companies' prior authorizations, by dealing with myths promoted by, uh, a lot of influencers. And unfortunately, a lot of our medical societies aren't really doing much about it. Uh, I have seen with a lot of the pseudoscience that RFK Jr. is putting forward, one thing that's really warmed my heart is to see the leadership of the American Academy of Pediatrics and the American College of Obstetrics and Gynecology and several other leading societies that have banded together to combat this pseudoscience. Most recently, even several of the surgeon generals have made statements on the dangers that face us now because of the recklessness of RFK Jr. What's fascinating is I've loved to see these societies banding together, but I think, why can't you band together against insurance companies as well? Because I think more people are hurt and harmed by the delays and the denials put forward by insurance companies in denying access to care. I think that is the bigger problem. That affects more people. And why can't they band together against that? Because candidly, a lot of docs and a lot of these societies, they don't have the funds and the lobbying power that other agencies and groups have. And the fact is, because our elections are bought, because of the system that's in place, they are influenced heavily by money, control, and votes. And unfortunately, as a medical community, we don't have that type of money or control. Others do, and so they get the ear of those in power. But I would really love to see some of these medical societies band together. I've been kind of embarrassed by my own medical societies, the American Academy of Allergy, Asthma, and Immunology, and the American College of Allergy, Asthma, and Immunology. They've remained pretty silent on a lot of these issues that deal directly with the immune system. They have not led like the other societies. They will put out a token measure here or there, but it's like, step up, have some courage, and say something. Why can't these societies band together against CMS and insurance and take a stand? And I would argue that that may have as big of an impact as them banding together against the pseudoscience that RFK Jr. is putting forward. This stuff just has to stop. America is definitely getting sicker. There are so many high level issues with it. But one of the other barriers that's feeding this is not just insurance, not just our government, but it's also influencers that have become so influential. Why have they become so influential? Because for the most part, influencers are quote unquote coaches. They're able to get cash deals to peddle products, to scale products. They can get cash deals that will scale unvalidated and unsubstantiated tests, nutraceuticals, and supplements that have very little oversight. A lot of the tests that they're selling, a lot of the products that they're selling don't come under the purview of the FDA. And these coaches, because they're not doctors, don't have the liability that doctors have. So what they'll do is be able to market online, target people online, push the product, push the test, sell the cash, scale their product with no oversight. And still at the end of the day, if it doesn't work, do you know what they say? Oh, I'm not a doctor. Go talk to your doctor about this. Or even prior to that, they may say, we're not doctors, we're not giving medical advice. Here's the product and here's why we're doing it, but go talk to your doctor about it. Then we have to spend all of our time dispelling those myths. It's not that we don't know about the tests, it's just that a lot of them don't have evidence to back them up. And guess what? What I said at the beginning, we have to justify everything as medically necessary, whether it's a test, a procedure, or a medication. And so the influencers, though, can scale these cash businesses and make millions off of you from unsubstantiated products, and they can be very convincing. Why? Because they've all taken online courses of how to market, hook, story, close. Like, it's all there. They're going to have a flashy headline. Here's the hook. Then they're going to have an emotional story that talks to you about that taps into your, emotions. Hooks, kind of reels you in more. And then they're going to give just enough science to make it believable, mixed in with a lot of their pseudoscience to ultimately sell their one product. Why? Because they all know from marketing that the one thing sells. Unfortunately, a lot of health and things aren't boiled down to one thing, but they don't care. The one thing sells. That's it. Now that they have the sale, if it doesn't work, guess what? We're not doctors. Go talk to your doctor. And that's kind of revolving. And yet those doing real medicine and real science are constantly having to answer to insurance companies and the government at every level to prove every single test, every single medicine, every single procedure, making sure it's medically necessary, backed by evidence. But it's sucking us dry at the same time. And we don't have the manpower or the funds even to combat the cash cow that's happening with online marketing. Because the system is so broken, it's really easy for these influencers or functional medicine doctors to create distrust with traditional medicine. It's really easy for them to create that distrust. And with that distrust, patients will question. I think most doctors are okay with the questions. But most docs are doing a really, really amazing job, a truly amazing job dealing with the time pressures, the financial pressures, the liability pressures, and doing all those things while combating those three key barriers that are between us and a patient. At some point, docs, though, we've got to stand up and we've got to demand more for us and ultimately for our patients. We have to. This system that's so broken is there's such larger views in terms of why America's getting sicker. And these barriers certainly don't help. So much commerce is being promoted over common sense. And hopefully, at some point, things can change. Hopefully, some of our societies, some of the leaders in medicine can stand up and start recognizing some of these barriers so that we can deliver more effective care to patients and really get them the true science that they need, the evidence that they deserve, the care that they deserve without having to constantly jump through all of the hoops. In fact, I think in terms of insurance, we're always having to prove things are medically necessary. I think insurance should have to prove some things to us. Like, why is it not medically necessary? Because we just gave you all the notes as to why. Why do they get to make the rules in terms of what their criteria is for certain procedures and medicines? Why are they the ones making the rules? Why don't medical societies make the rules based on the evidence, and then insurance has to kind of prove why, perhaps we're going against that? I think this system is really backwards, but the issue is insurance. It's kind of that quote from Aladdin that original movie of Aladdin where they said it's the golden rule. He who has the gold makes the rule. Well, in this case, we all know insurance has the gold. They make the rules. But somewhere along the lines, and politicians have the gold and they make the rules. Somewhere along the lines, something's got to change where we're putting humanity first, where we're putting the good of patients first. Health is a right, it's not a privilege. And people deserve care no matter what walks of life they come from. People deserve docs that have the time and the ability to actually think through their problems, create plans, and be able to execute on those plans accordingly. Um, Patients deserve that. And I know this episode was probably longer than normal, but those are just a lot of the things that have been on my mind. And somewhere along the line, we need to make some edits with insurance. We need to make some edits in terms of what we accept as a standard of care for health in the United States. And we also need to make some edits in terms of what we're believing when we click on that hook from an influencer. What are we believing? How far are we going to go? And who can we trust and who can we believe? There's a lot of really great docs out there doing some amazing education online. Seek those out. Seek those people out because they're in your corner. And that's all I have for today. Thank you. Thank you so much again for tuning in. We'll see you next time on The Immune Edit. This show is separate from my clinical practice at Global Allergy Immune Network. This show represents my opinions and my guests' opinions. Neither myself nor the show endorses the views or statements of my guests. This show is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional. This show is provided with the understanding that it does not constitute medical or other professional advice or services. If you're looking for help in your journey, please seek out a qualified medical practitioner. It's important to have someone in your corner who is a trained and licensed healthcare practitioner who can help you make changes, especially when it comes to your health.